seen anything like that. I mean, I've seen Jiu-Jitsu, but those guys are amazing.
A great honor to have the Machado brothers.
Machado.
It's Carlos Machado.
And I've been texting Alicia here and there. Are you still at the location? Are you, which one you are more often?
I go to the McKinney office more than any office.
Okay, good.
We've got 86 locations now. Yeah, 27 states.
I think on chat, they have to update because they had 70.
Oh, really?
Yeah. So
yeah, we've got 21.
now, how does that work? You have a group of people. You guys co-own the franchise, or you own a certain number of locations?
Yeah. So Chad, my partner, and I, we 50-50 own the whole thing. And so we partner with other chiropractors in different states that are wanting to bring this in as an adjunct therapy. So we partner with them and we open up a Genesis back and neck location inside of their already existing chiropractic practice.
That's smart.
Yeah.
That
so
is smart.
It would be like if you, I don't know anything about martial arts, but if you had a jiu-jitsu place, but you also wanted to offer karate, but you don't know anything about karate, well, you could bring this in and then boom, you've got it.
I got
Or
you.
if you were, you were a steakhouse, but you wanted to do sushi,
Wow.
you brought in the sushi. So
We'll definitely talk about that, and we'll talk about whatever you want to disclose in regards to Genesis.
yeah. Awesome.
All right, another episode of Coffee Time with Carlos Machado. I have here with me Dr. Caleb Braddock, and I have a little backstory to tell real quick. I had 6 years ago a severe lower back pain that had a sciatica going on. Did some X-rays, some imaging, and I went to 3 different doctors prior to visiting Genesis, where I came across you, your protocol, and the equipment that you use. And one thing that surprised me, and I'm going to go ahead and say that you are the first one that actually had the imaging on your consultation with me. You went over what you saw, explained to me what was happening, and told me exactly what your treatment is likely to do to my situation. Because up to then, I had just a quick visit. You know, they call doctor's visit. You come in, you come out. You gave me a complete different experience in that regard. And that right there caught my eyes and my attention. And I had a free consultation at that day and experimented with the DX9000, which we're going to elaborate more on that. And I was in a very dire situation. I had to be transported on wheelchairs when I was traveling in airports from the check-in, agent all the way to the gate terminal. It was not easy, and I was teaching seminars. So my wife found your ad when she was browsing. I'm not sure if it was Google or if she used Yelp or something like that, but she sent me a text. Hey, check this out. I sent a text, and Miss Alicia, who gladly I still works with you. She's a go-getter. She answered. It was a weekend, off hours. She replied. So there were a lot of good things happening in alignment for me to go visit you, and I felt very slight relief the first day. But it's still, one session is not gonna. But I could, throughout the whole journey, following your protocol, I could see incremental and significant improvement week by week, to the point where by the time I was done, I had zero symptoms of whatever pain I had experienced. There was the most pain I experienced in my life prior to visiting your clinic. So bringing you here, I can tell up front to all the listeners, I believe in what I do. I believe in what I experience. I wouldn't bring somebody here if I didn't go through or saw the results with my own eyes. So I'm glad to introduce you to our audience, Dr. Braddock, and I'm very happy that I met you.
Well, I appreciate everything you said there. I think, one, I'm just esteemed to be here. It's super cool to be exposed to the guys that follow you. The thing I love most about what you said is your experience. Mm-hmm. And so we're really big on experience, and so so far in medicine and those type of things, experience is lackluster. People just really feel like their arms being twisted to do anything, and they don't have any sort of experience, or at least a positive experience. So I appreciate you sharing what you shared. I know that when you came to me, I'll just let the cat out of the bag that I'm not a martial artist. You know, I have no jiu-jitsu training whatsoever. I carry a gun every day because I don't have the ability to do the things that you guys do. But I was like, man, even as somebody that's like me, that's in the dark, knows your name, you know, knows your family's name. And then to see you come in, you know, in such bad shape, and knowing that you're going through the airport in a wheelchair, knowing that you're supposed to be teaching guys the wealth of knowledge that you have inside of you, but your physical ability wasn't letting you. It was like, man, we've got work to do. And so just super proud to be a part of it.
So the way I wanted to bring this conversation into somewhat of a rabbit hole here. So I'm going to talk about the patients first, the type of patients that you have, like for instance, age groups. Is there a particular predominant and gender, if it's more women than men? So that criteria right there, what's your experience in that regard?
Yeah, so I think the easiest thing to start with is I'm this next month in October will be my 20th year in practice. So I am a chiropractor. I'm a trained and licensed chiropractor. It's my favorite thing. I could wax and wane about chiropractic and the multitude of health benefits it has for people here. I think so much of your audience would benefit from chiropractic. Where the change is about 7 or 8 years ago, the person that I had the most trouble getting success through chiropractic care was a bulging disc patient or a herniated disc patient. And so as much as we would love to be able to help that, we don't have a chiropractic adjustment that fixes a bulging disc or herniated disc. There's no PT, there's no epidural injection, pain management, stretching, cupping, arosty, acupuncture, PT, all those things are simply treating the symptom that the disc is causing. And so it's like, there's got to be a better way. And so my partner, Dr. Chad, and I got together and we came up with this thing that's now Genesis Back and Neck, which has become a big deal. And so we only specialize in bulging herniated degenerative disc. So to get to your question, who is that? What's the demographic? Typically, if we're speaking generally, it's people 40 to 70. Most people are getting these injuries when they're young. In high school, college, rolling, fender bender, sports injury somewhere. But it's not that big a deal. But it's kind of like a cavity. You can have a cavity for a very long time with no toothache. But then when the toothache's there, it's suddenly serious. And so most people aren't really getting that toothache, if you will, or that really bad symptomatology until they're later in life, say 40s on. But right now in our office, we probably have 5 or 6 kids. I say kids because I'm older, but that are 20 and to 14, high level athletes, gymnasts, all sorts of football players, those sort of things that do get those things. So it's just a little bit less common, but it's possible. But most of the people we see are on the later half where they're like, man, all of a sudden I turned 40 or 50 and my body's failing me. My disc is herniated, those sort of things. So not necessarily men over women or women over men. I think it's probably equal from what we see. So
when it comes to chronic back pain, is this the majority of the reason your patients seek out your help?
Yes. Yeah. So there's a multitude of reasons that people can have back pain. Not all of them are discogenic, meaning they come from a disc injury, but the ones that are really serious. So at Genesis, 50% of the people we see have already had one spine surgery. They're trying to avoid a second or a third. So we see people that are in really dire straits. Really? They've tried 1, 2, 3 epidural injections. They've done rhizotomy. They've done pain management. They've done physical therapy, and they're really staring down the barrel of a surgery. Now, like I said, there's a lot of other reasons that you could have back pain that maybe chiropractic could help with, or physical therapy, stretching. Like there's a lot of great modalities out there. But once that disc herniates or ruptures and it puts pressure on that nerve, it's a purely mechanical problem that has to have a mechanical solution. There are only 2. Cut it out or pull it in. And so obviously everybody out there is trying to avoid the cut it out thing because the success rate's just not as much as we would like it to be. And then as far as pull it in, that's what comes down to what we do with true spinal decompression, which we could get into a little bit more, but spinal decompression is very nuanced. And a lot of times people are doing traction, or they're doing things they think are spinal decompression, but it's not true decompression.
So from what I understand, you're saying many of the patients, they come to you after they tried the injections, the PT, and some of the other forms of treatments with no avail. Then they finally come to you for that. Yep.
Yeah, I hate to say it, but sometimes we're the last ditch effort. It's like I've tried everything else, and I may go jump off a bridge today, but I'm going to give this a try. So,
one of the things that really, nowadays that's really amazing to me, because when I experienced back pain to the degree that I had, because I remember when I had it the worst, there were 3 nights in a row I couldn't sleep, and I don't take painkillers. I think that was the only time I took ibuprofen, 800 milligrams. It did help, believe me. But I see pain treatment and pain relief becomes somewhat, because I was thinking, if I cannot stop this thing, how can I actually fall asleep or have a night of sleep or rest and mitigate the pain? And you and I talked about it. People always talk about the opioid epidemic and stuff. And I wonder, in your personal experience, I think we talked briefly about that, if you may recall, how many people you've had they were dependent upon those medications, and through the treatment with the X9000 and your protocol, they're able to let those go.
Yeah, this is something we're really passionate about at Genesis, is because there's so many people that are reliant on medication just to get through the day, not to thrive, but just to survive, just to get through the day or get through the night, to get to the next day. And then they're really struggling with those things. And I remember it was my first year in Genesis. So it's about 7.5 years ago. I had a gentleman that I was doing a consult with, and he had a herniated disc. We were talking about all this, and he became very emotional, which happens a lot, but I wasn't quite sure what was going on. And he confided in me that his wife, a couple of years before that, had a herniated disc, and that they had taken her to the doctor, and they did kind of the general routine of the way that you go through these things. And they'd given her opioids, and then she had gotten more opioids. And he said even that day before, he had called the doctor and said, "This is not okay. Like, my wife is not herself. We have to do something." And the doctor's like, "She'll be fine. Just give her time." And then that night, the next day, that morning, he woke up and his wife was ice cold, dead beside him, overdosed on opioids. These aren't junkies. This is a housewife in a suburban area, and in a large HOA, who just could not deal with the pain anymore, and these opioids claimed her life. And so this guy obviously is terrified. And so ever since that day, that's one of those stories that I've never got out of my mind. It's like Genesis isn't business for us; it's people. We're in the people business. Yeah, it's a mission. And so we've recently updated that this year, where we now have a mission to save 1 million people from spine surgery. So that is our overall mission, 1 million people from spine surgery. And trust you me, we are counting, we're calculating, because it's people like that that have these issues, that it's like, man, that lady could have been saved. Hopefully, you never know, but potentially she didn't have to have that demise.
Well, that's an unfortunate, tragedy right there. But even in the instances in which they don't overdose, I think I have friends of mine, close friends of mine, whose spouses had back surgery, and it was bad results or bad outcome. The pain kept going, and they had to take pain medication, and it completely changed their personality to the point that at one point in time, they ended up divorcing. I mean, I'm sure you can relate to that in terms of, you may have heard of such stories, right?
Yeah. I mean, it's all too common. And I've got friends that are neurosurgeons and orthopedic surgeons. So I'm not the kind of guy that says there's never a time and a place for surgery. But man, we will do everything we can to avoid it. And we truly believe everybody deserves a chance to beat it naturally.
Mm-hmm.
Everybody deserves that chance. And if you can't, and it's the last ditch thing, and you have to have surgery, you do, and you find a great surgeon, the great reputation, who's passionate about what he does. But it's, man, the longevity of those surgeries is very low. And then the likelihood of you, one of my friends who's a surgeon says, Caleb, what you don't understand is most of these people don't know, but they're trading pre-surgical pain for post-surgical pain. That's it. That's tough, you know?
I have a question. In your professional opinion, if people were to seek out some of the modalities or treatments that you have available to them, I know it's hard to say without doing it this way, like maybe doing a couple tests, but what would your opinion be if they were to seek out what Genesis has to offer before doing all the other injections and surgeries? What was your thoughts on that?
Well, I think obviously I'm biased, but I think Genesis is a great place to start. If so we'll just talk about like what are some common characteristics of a bulging disc, herniated disc. 9 times out of 10, it's worse on one side than the other. So we're talking lumbar or cervical. So let's just say we're talking lumbar. You know, you have the pain on one side, right side, let's say. It usually radiates down into the butt of the leg in a very specific manner. So it's never like the whole leg. It's like the top of the butt cheek, the outside of the leg, the lateral thigh, or it's like piriformis. A lot of people think it's piriformis syndrome, and it's hamstring to the sole of the foot. Or, you know, it's here with cervical, it's maybe your first 3 fingers versus your last 2 fingers going numb or tingling or burning. And so usually it's worse if you're standing, particularly low back. If you have to stand in a line at the grocery store and be still, it's agony. Most of my disc patients, they're looking for a place to sit down. Like, man, if I can sit down,
Yep. That's how I felt.
I can get a little break if I can sit. But if I'm standing, it's agony.
Yep.
And then if it's bad enough, if they cough or they sneeze, that increases interthecal pressure. So it causes just that zinger, that jolt. So when we have somebody come in to Genesis, and we've had this, for me personally, yesterday, I had 2 patients that came in, walked them through, they talked me through their symptoms. They didn't have a disc issue. It's like, look, you need to see I'm obviously pro chiropractic, physical therapist. You don't need to do decompression if you don't have a disc issue. But if you start to have some of those symptoms and you have a disc issue, Genesis is a great place to start because you can circumvent going to the doctor. It's typically what happens. People go to their medical doctor, who could be a great guy, and he said, "Ooh, you got a spine issue. You see the spine guy." You go see the spine surgeon, and he's like, "Well, I'd rather not do surgery on you." Well, that makes you feel good because you don't want a cut happy surgeon. And so you're like, great. He said, let's start with physical therapy. Some of my best friends are physical therapists. It's amazing, but it's largely unsuccessful for bulging and herniated disc. And so you go do physical therapy an hour a week or an hour a day, 3 days a week. After 6 weeks, you know, you're either not better or it's maybe even aggravated it sometimes. And so you go back to see the spine guy, and he said, Carlos, I'd really rather not do surgery still. Thank goodness. That makes you feel good. So then he says, let's see my friend, the pain management guy. Mm-hmm. And then you're doing epidural injection, rhizotomy, you know, gabapentin, Flexeril, those drugs. And none of those things are designed to be curative or restorative. They're just simply designed to give you some short-term symptom relief.
It's like a patch.
It's a patch, you know, and most of those guys are very honest with you. It's not like they're trying to deceive you. That's the tools in their toolbox. Right. And so then when that doesn't work, you're probably 8 months in, you're disenchanted, you're not living your best life. You go back to the spine guy, and he said, well, I didn't want to do it, but now let's try a minimally invasive spine surgery. And so at that point, you will do anything to get some relief. Yep. And then also, since you failed the conservative measures like physical therapy and pain management, now your insurance will actually pay $150,000 for a spine surgery. And then most of those surgeries have a very short shelf life. Yep. And so a lot of times those surgeries fail. They fail so often, there's an ICD-10 code, a diagnosis code called failed spine surgery syndrome. It's its own diagnosis.
True.
And so every day we just wake up and we're trying to get to those people that are looking for a natural alternative, a true alternative and a true solution that if we can truly change the integrity of the disc, we can get the pressure off the nerve, we can get you back to doing not just like making it through the day, but like kicking butt, like doing, jiu-jitsu or playing with your kids or.
I was training yesterday. Me and Roger were just rolling like I normally do,
Yeah.
You want to complete with something else?
Yeah, I was just curious, how much of your patients could probably be served, or would you say have back pain symptoms from, like for me, I do self-research. I was in the military for 20 years, so their first thing is physical therapy, and I went through this whole thing. Oh, do the bird dogs, do the dead roaches, do all these leg things. You basically said you have a weak core. You have a weak core. And I was like, that's impossible. Like, that can't be the answer. Why? But come to find out, I had what's I believed anterior pelvic tilt, and that caused a lot of my, Donald Duck butt, as they call it on YouTube and some of the channels that I've went through. A lot of hip flexor stretching, psoas stretching. I had a tight psoas. Like basically everything in my hips caused my lower back pain, from what I believed. That and some other stuff happened, but that's what relieved my problem. So I'm curious, how many of your patients would you say, or percentage, or is this even a thing, would you say have actual like tight hips or from sitting? Because it's so many people now working remote.
I was about to ask
sitting all
that.
day.
Because nowadays people that work on desks and they're sitting all the time. We talk about ergonomic treadmills that you can elevate your desk and be standing and walking a treadmill. It's not, in every office, but what would be associated with disc degeneration? And also in the age of cell phones, where people are just kind of bending forward their neck, has that affected the incidence of numbers in terms of people seeking
I think
help?
so, for sure. I think the way you think about it, all the parts of your body stay healthy because of blood supply, right? So blood brings nutrients and it takes away waste. And the only part of your body that doesn't have that is when you turn about 20 or 21 years old, your intervertebral disc, the cushion of the spacer between the backbones, loses blood supply. And so when it loses that blood supply, the only way that a disc stays healthy is what we call the imbimbant pumping action. So whenever the disc pushes down, gravity pushes down, it pushes out the waste. And when it pulls up, it pulls in nutrients. So imagine if you have a sponge in the kitchen sink and you're using it. It's thick and wet and pliable and hydrated. And so that's like the intervertebral disc. That's that disc. Wow. But whenever there's no motion there, so which can happen from sedentary lifestyle, which everybody has now. I mean, it's just, what do they say? Sitting's the new smoking. We're working at computers. People are sitting at a desk for a long time or staring at phones, stuck in traffic, that sort of thing. So that sedentary lifestyle starts to just let that sponge, like you set the sponge on the counter for a week, it dehydrates, it dries up, it's brittle, it's it's not squishy. The other thing that can happen is from an injury, you can have an injury, and as chiropractors would call it a subluxation, but it's when one motion unit doesn't move correctly. So let's just say it's L5 and S1. You have some sort of a sports injury, something like that, and that vertebra locks up and it's not moving appropriately. Well, if that vertebra, the rest, you could still bend over and tie your shoes. You may not even have much pain, but if that motion unit is not moving properly over time, if the disc isn't moving, it's getting unhealthy. And so that's why I said a lot of the disc issues that we treat are things that started relatively benign years prior, but over time, a disc that's not moving is not healthy. And if it starts to dehydrate and get thin and dry and brittle, then it becomes weak. And so then when there is a dynamic movement, something big happens, and maybe not even something big, maybe like you've been over to pick up the newspaper in the floor, then all of a sudden all hell breaks loose and you're just crippled. And you're like, man, I didn't do anything. This was fine until I bent over, and then I don't know what happened. But it's a problem that can be helped. And so we're huge advocates of motion, like motion's lotion. We want you moving. We want you stretching. We want you active. It's way easier for us to fix the spine in motion than a couch potato spine. Mm-hmm. So we have a lot of people that are CrossFit Games athletes, that are Jiu-Jitsu guys, that are power lifters, that are football players. And that's easier to fix. Those guys, even though they're hard on their body, it's easier to take care of them than it is the person that sits at a cubicle for 8 hours a day.
This episode is sponsored by Stay Humble Coffee. Coffee is so good, it doesn't need to brag. Find it at stayhumblecoffee.com.
So I'm curious, as a guy who sees lots of people that have bad backs, or there's going to be a lot of people that are in jiu-jitsu or maybe any other martial art or maybe other sports that are going to see this. I'm curious what kind of preventative measures you can suggest, maybe pre or post stretching routines or anything you might think would be helpful to people who want to stay active in their sport or active on the mat for life.
Well, may I add one thing here? I think it wouldn't be a bad idea, too, for preventative measures, that it wouldn't hurt for them to do the decompression as part of their rehab or recovery protocol, don't you think?
For sure.
Okay.
Yeah, we see, everybody is unfortunately motivated by pain. So when somebody's in dire straits and they're in a lot of pain, then they're motivated. But we do see a good handful of athletes in particular from a preventative standpoint, proactive standpoint. But to answer your question, like I said earlier in the podcast, self-admittedly, I'm not a jiu-jitsu guy. I have no training in that. But when you think about flexion and extension, right? So flexion is us doing crunches. Mm-hmm. And so when you flex to the front, the disc goes to the back. Mm-hmm. And when the disc goes backwards, all the important stuff's back there. That's your spinal cord, your spinal nerves. When you do extension, so like let's say you lay in the ground and you do the cobra pose, if you will, well, then the disc goes forward. And that's a really healthy place for that disc to be. If you think about the way we're all sitting almost in flexion all the time, looking down. We ride around in these big C-shaped candy canes, right? And so the more extension we get, the better. So I love like rows. I love cobra pose, any extension sort of poses. If you're in a gym on a rig or something like that, and you can hang from a pull-up bar just to get that decompressive force into your spine, I think it's a really good thing. And so obviously before you're active, after you're active, just some intentional motion and some intentional stretching. So often we get in and we want to get a great workout in or get a good session in, and you just go in cold, you leave, you just go straight home, or you sit in the car. And so just having that little intentional amount of making those changes and getting good motion in your spine, I think would pay dividends.
Yeah, I think incorporating, was that from Head to Toes? The name of the Instagram, that there's a stretch protocol that they do a lot of for different body parts, but it resonates with, I think there's a big segment of the sports culture that uses stretching, like Dave Goggins, for instance. He wakes up at 4:30 in the morning. I don't know how he manages to do that every day, but he stretches for an hour or an hour and a half. And the amount of physical activity that he has had and continue to have, he's at that level, that he needs to
If
heal.
you follow David Goggins, David Goggins, he's like, I think he must be the toughest man on the planet. It's insane. Mm-hmm. I've read all of his books. But he talks about all these insane things that he did. And then I think maybe in his last book, he talks about where his body just started to shut down.
Yep.
And so he didn't know what was happening. He thought he was maybe had a disease or something. And so now the guy stretches, like everything he does, it's ridiculous, but some ridiculous amount of time, 4 hours a day of stretching now, stretching out his psoases. And he basically said stretching was for sissies, he didn't say sissies, but that stretching, you didn't need to do that. You just ran through it. But man, it's powerful and it's important. Yeah.
I do believe it will make a difference, Roger. Yep. I want to get into the machine. I call the machine the miracle machine, the DX 9000. Can you elaborate and tell me who came up with that idea? The best way to describe it, it's a tower that has a parachute strap that connects your core to your lower back and to your neck, your upper back, and whatever area you need to pull, lower back or upper back, it hit on the spot without any discomfort.
Yeah, it is. I would go with Miracle Machine. It's really great. We didn't come up with it, so I don't own the IP. I didn't invent the machine. I don't own the machine. But at Genesis, in all of our locations, we only will utilize a DRX 9000. So it's the creme de la creme of decompression. A lot of practitioners out there are using a a low end traction table and they're saying it's decompression. It's like going to Steak and Shake and ordering the steak. There's no steak at Steak and Shake. You know what I mean?
Right.
And so it's really great. The machine's been around a long time. It's a couple of different iterations from something called the VaxD to a DRS to the DRX 9000. And so that's kind of the how it's transpired. It is the most researched machine in spinal decompression. And I think the two things that I will say that make the machine cool, and so if you're not sure what we're talking about, you could go look up DRX 9000 on Google or image search or whatever. But the things that make it special, one, in the tower is an intelligent motor, and it adjusts itself 13 times per second based on the body's muscular feedback. So if the muscles pull, the machine gives. And when the machine gives, the muscles pull. And so it plays tug of war 13 times per second at an imperceptible rate, because the way the good Lord built our bodies is such a delicate area with those nerves and those discs that if it feels like it's in peril or risky at all, the muscles lock up around it. And I mean, there are a trunk of muscles around that. And so what makes this machine special is it can basically sneak past those muscles to get to the disc, and it gives you the most comfortable and smooth pull of any device out there. And so that's how we can actually influence the disc itself. We can have pre and post MRIs that will show discogenic change, a 17 millimeter herniation to a 2 millimeter herniation, pre and post MRI proven because of that. And then the second thing, and the thing that makes it true decompression versus traction. Most people kind of think decompression and traction are synonymous terms, but traction is just axial. It pulls the spine in a straight line. It's like somebody tugging your head and somebody tugging your ankles, and it's just a decompressive force overall. With the DRX, once you get on the machine, let's say if you have an L5 herniation versus an L2 herniation, we change the angle to pull to mathematically match the angle of the disc. So we can target one single specific disc. So 85% of the distractive force that happens is going to happen right where it needs it. So let's say that you had, unfortunately, an L5-S1 fusion in the past. Well, we all know that if you fuse a segment of the spine, there's something called the adjacent segment syndrome, which says the area above and or below will degenerate at an accelerated rate because it's having to take up for the slack for the area that's fused. And so let's say you had L5-S1 fusion. 5 years later, now you're having an L4 disc issue. We can still treat that L4 disc above the fusion because it's that specific. And so that's what makes it true decompression, is we can target and deliver targeted treatment to a specific disc to give you predictable outcomes.
So I guess most of your patients are post-back surgery, or?
I would say 50% of our patients are post-back surgery.
Yeah.
And the other 50% we're trying to save from ever getting there. So,
yeah. What is the most prevalent reason for the patients to seek out the treatment with the DRX 9000? What is the number one, out of everything, what was the culprit, the one that's more often the case?
It's usually a feeling, and I hate to say it, but it's a feeling of helplessness, like maybe this won't ever go away. So most of the people we've seen or that we see, they didn't get in a car wreck last week or, do a crazy deadlift last week. This is something they've had for a long time, and they usually do XYZ. They take an Advil, they get an adjustment, they do this thing, and they give it a day or two, and it goes away. And it happens ever so often. And then it starts to happen more often and lasts a little longer. Happen more often and last a little longer. Until finally they show up in our office when they're like, this isn't going away. Like, it's been 3 weeks. It's been 6 weeks. I've tried. I did all my stuff that I normally do, and I'm afraid this is going to be like this forever. Or they've gone through the traditional route, and really they feel like the only option left is surgery, and they're seeking out, like, is there any non-surgical option? And so we are the number one non-surgical option for bulging and herniated disc.
So if a patient seeks out your help, I know what happened to me, but what is the journey? Let's say they book an appointment, you have a one-on-one with them.
Yeah. So we sit down with every single patient, and a majority of our patients will actually show up already with MRIs. They've already had MRIs or CTs or x-rays. That's how they've gotten diagnosed in the first place. And so, like you said earlier, like we started the podcast with, we take the time to sit down with each patient. We have a 70-inch TV screen, and we're going to walk them through their MRI. So most of the patients are kind of parroting these terms where it's like, well, I have spinal stenosis, or I have neuroforaminal stenosis, or I have these things. And it's like, do you know what that means? No idea. That's what I've been diagnosed with. So that's the term they carry around. And so we feel like it's important for that person to have a mechanical understanding of what's going on inside of your body. Because if you can understand that, then you can start to make some real world decisions about what makes the most sense for you. Is this a good option? Is this a good option? And so we really are about empowering the patients, and we do a decent amount of education. We want you to actually see your MRI. The number of patients that have come to me with an MRI but have never seen it is shocking.
They don't even know what it means.
No.
They don't know how to read it.
And they give a disc and they go home. But even if they were get that in the computer and open it up, they don't know. That's not their wheelhouse. They're not supposed to know what vertebra is what vertebra, what part of the body they're looking at. And so we take the time and walk every patient through that. If we believe that we can help you, we'll tell you. And if I don't think I can help you, we'll tell you that too. So we refer all the time. We refer to physical therapists. We refer to surgeons when it's necessary. We refer to chiropractors. Those are the things that it's like, we want to make sure that you're in the right place. And so, but if it's a bulging, so that we only treat 3 things: bulging, herniated, degenerative disc. If it's one of those 3 things, it's a godsend what we do. If you don't have one of those 3 things, you do not need to be in a Genesis office. You need to be in a different type of office. The thing I love about all of our Genesis doctors is they're high integrity, and they're the smartest guys on the planet. So even if they're not the person that's going to help you, they're highly networked people that can say, oh, you need to see Dr. So-and-so. You know, this isn't a Rusty guy.
This episode is brought to you by Machado Method Nutrition, premium fuel for disciplined athletes who train with intent and recover with purpose. Live the method, fuel the life. Start now at machadomethodnutrition.com.
This is an acupuncturist that I know. This is the best neurosurgeon in our area. Like, they know the people to get you in front of, even if they're not your person.
Yeah, just for the lame person, bulging, herniated, and degenerative. So if you had to give just a quick distinction.
Think of it as a jelly donut. So if you have a jelly donut and that donut starts to stretch out and become bigger than it should, that would be a bulge. So the jelly's pushing the donut out further than it should be. Bulging disc. Now let's say the donut tears and the jelly has squirted out of the donut. That's herniated disc. And then degenerative disc would be, the easiest way to think about it is a sponge that I mentioned earlier. It's just a dry, dehydrated sponge. Sometimes people have a degenerative disc and the doctor will be like, Carlos, you hardly have any disc left. Well, in the analogy I gave earlier, if that sponge is dehydrated, there's no less sponge. The sponge material didn't go anywhere. It's just dehydrated. It's thinner because of that. You can't lose the disc. It's just a dehydrated disc. So those are the easiest, simplistic ways to think about it.
The way you explained to me when we had the consultation, and I still recall that, is you give breathing room to your disc by gently decompressing the area by pulling apart the vertebrae that are compressed, and the body in itself will replenish with fluid as the sessions ensue, to the point where the disc will have enough cushion to hold its own once we're concluded. Is that pretty much how it works?
That's it. And an analogy I'll use a lot of times is if you have, say, the back right tire on your car is low, and you go through the parking lot and you hit a speed bump, if the tire is low enough, the rim will hit the asphalt. And we all know what that's like. It's like, oh man, it just makes you grit your teeth. But if we can just get enough air in the tire, we don't even have to get it aired up as much as the other three. But if we can get enough air in the tire that there's a margin there, so you go hit the speed bump and the rim doesn't hit the asphalt, you go bump, bump, like every other person gets to drive over it. And so that's what the machine does. It's obviously not pulling air, it's pulling fluid into the disc, but we don't have to give you a disc like you're 18 years old again. Surgery's certainly not going to do that. We just have to give you enough breathing room, like you said earlier, that there's no pressure on the nerve. And you don't experience pain. Your body's incapable of experiencing pain unless there's pressure on a nerve. Like your nervous system is what you sense that pain through. And so if we can just make sure that there's enough space that no matter what happens, it's not pounding that nerve, then you do the things that you want to do easily with no pain.
So talking about the protocol, I remember we had the time lapse of 12 weeks and I think an average of 2 sessions and I'm a week, a 12-week program. And then I guess we do maintenance afterwards, depending upon what recommendations are. And I believe it's a safe and recommendable thing to do. But then you have the calibration that I guess you start nice and easy. And as the patient progresses through the treatment, you up the notch a bit here and there in the amount of pressure in which is pulling the vertebrae apart. Would you be able to kind of give us an overview how that process works?
Yeah, working our way in reverse. Just like if I came to you guys and I'm like, hey, I want to take up jiu-jitsu, you're probably not going to put me through the hardest workout that I could possibly do because you hope I'll come back this week, right? And so obviously if I'm coming off the couch and I'm starting to take up this discipline, then you got to ease your way into it and you got to learn what can you do now, what things to be thinking about, and then we ease the body into it. No different than weightlifting or CrossFit or anything else like that. So we always start a patient on a light weight, and then we incrementally increase the weight based on their body's ability to do that. It's not cookie cutter. We don't do the same thing for every person. We may have a guy that comes in that's, just jacked and snorting protein powder. And then we may have his grandma who's 85 years old come in next. We're going to treat those patients specifically for those patients. So we do incrementally increase the weight over time. And then our protocol is a 12-week protocol, and that doesn't vary, whether it's grandma or whether it's grandson. We do that because the literature shows that it takes around 12 weeks for a disc to heal. So let's say that I had a broken arm. It takes 6 weeks in a cast, right? If you have a broken arm, it's 6 weeks in a cast. The next guy has a broken arm at 6 weeks in a cast. We know it takes around 6 weeks for a bone to heal. It takes around 12 weeks for a disc to heal. And our goal is that once you're done with your disc protocol, the goal is that we don't see you anymore. So we're not the kind of guys that are like, you need a lifetime membership to Genesis. No, we want, I think seeing a chiropractor in your area would be a great thing. I think stretches and exercises and making sure you're taking care of your body is a great thing. But we're not a long-term thing where it's like, well, if you want to feel good, you got to see us forever. No, we want to rehab that disc and get it healthy and then send you back out into the world. So, we have some patients that are in certain situations that'll probably need long-term maintenance. But the majority of our patients is once you're good, you're good. And we want you to go use it and have a good time with it. So we don't see you forever, but we want to see you for 12 weeks. So,
and hey, it was the best 12 weeks I've had, and it was worth every week. I'm telling you that. Do you integrate the treatment with other modalities like rehab, nutrition, or other modalities? Or what?
Not so much. So with Genesis, once we have identified it's a disc, we treat it like a disc, and we use just disc therapy, which is decompression. Now, so we're in Genesis offices. If you're in there being treated for an L5 herniation or a C5 herniation, we're not doing, we're going to give you alpha lipoic acid, and we're going to do some soft wave and cold laser and some adjustments. And it's just spinal decompression because that's the most important thing for the disc. Now, I have friends in every modality. So I've got a soft wave machine in my office, and we love chiropractic and stretches, and we do tons of nutrition in my office. So we love all that stuff. but we keep the main thing the plain thing and the plain thing the main thing. And so once you're done with your disc and everything's better, then yeah, we can definitely point you in the right directions of all those things are important. You need to be doing all those different things. But I feel like so often people get inundated by 90 different things they're supposed to be doing and keeping up with. And then if something is working, they're not sure what even, was it because I took this pill or this vitamin or I did that stretch or is it this? And so we keep it really simple with Genesis. It's just spinal decompression for those 12 weeks. Now we're encouraging people to stay active. We're not limiting where you can't lift or you can't roll or you can't do this or that. We want people active because that's how you actually know it's working, right? The proof's in the pudding. It's like, hey, 3 weeks ago, I had trouble getting on a plane without a wheelchair, and now I can walk to the terminal. Like you should be seeing those incremental improvements. So,
how fast do people show improvements on pain relief using the?
That's a tough one. We have people that from the very first visit, like the demo treatment, they get off with tears in their eyes, and they're like, "I can actually see a change." We have other people that might be 6, 8, 10 visits in before they really start to notice a corner where they start to turn a corner. And so it really depends on that. But usually within the first 6 or 8 visits, you should know you're in the right place. You're like, wow, this is good.
I want to shift gears now a little bit more for the mindset of the mission. Okay, because I truly believe, Dr. Braddock, that what motivates you to go to work is not just the fact that you perform your job, that you have your knowledge that you impart through your profession to your patients, they benefit from it, is because, like you said, how many back surgeries can I help avert? How many people I can get out of using pain meds and all those things. So I'm sure that there's the human factor, So would you mind sharing with us right now the story behind Genesis neck and back pain? How did it started? Who created it? And what has been the reason for it?
That's a good question. So, like I said, I've been in practice for 20 years this year, and I eat, sleep, and breathe chiropractic. Well, one of my friends in chiropractic school, who's still one of my best friends and business partner today, Chad Glines. So Chad, and I wish he was here to tell his story, but through a turn of events with a family member, he just wanted to fix herniated disc. And so he got into spinal decompression, which was almost 2 totally different ends of the spectrum. But as time went on and I started to see more and more patients, it's like chiropractic is miraculous, except for the disc patient. They get up, they get like, oh man, that's perfect. And tomorrow they're like, it's all back. It's all back. It's not going away. And so that's when I was like, there's got to be a better way, because I got tired of losing patients to injections and then to surgery. It's like, there's got to be a better way. I've got to save these people. And so Chad and I got together, and I have had some success in chiropractic and coaching and systems and procedures and that stuff. And then Chad knew all the stuff about the DRX 9000 I learned from Chad. The protocol that we use for spinal decompression, Chad Glines developed that. Dr. Glines developed yes, wow. He developed the Genesis protocol that we use, and it's rock solid. It's actually nationally recognized by the producer of the machine now. Wow. And so we got together and we said, man, what if you took all the things that you know about decompression, the protocol, the disc patient, and the things that I know about systems and procedures and marketing and aesthetic, and we married those together. And we had a conversation, and I'll just give the credit to the good Lord. Like, I really feel like this was a totally inspired thing, because it wasn't hard. We had a couple of hour conversation, and then the next week we were looking at spaces in McKinney, which was where our first office was. And 45 days after that, we were open. And so that first year, we really started to develop the model and see how to help the patients. And honestly, it was really there that I started to see patients that, even in the last 12 months, I've seen 3 patients that already had premeditated plans to take their own life. They're not just throwing that around willy-nilly. Like, they had a plan, They're like, I will not live like this. I cannot live like this. And so that's really where the mission got inspired, it was eye-opening to me, honestly, to see how many people out there are hopeless. They think they've tried everything. They think there's nothing left on the table. All these doctors have promised them the moon. And even though they may be great guys and they're trying their hardest, the doctors are trying their hardest, but these situations just don't turn out good. And the patients feel like they're banging their head against the wall and there's no way out.
Yeah, so when Genesis started, was already with DRX 9000 in place. Oh, so that was then.
We've only used the DRX ever.
So there was no previous chiropractic clinic by itself. You had the DRX from day one.
Yeah. So my office, my chiropractic office, we've only did chiropractic for years and years and years.
Right. But it was not Genesis then.
That's not Genesis.
Okay,
That's
I got
Braddock Chiropractic.
Okay.
And we still operate. I was in that office this morning. It's my favorite thing to do. I love chiropractic. I could talk for days on that. Genesis it's a niche. It's the disc patient only. It's not the person with the tight SI joint or the person who has some stiffness in their neck. You know, with Genesis, we're not seeing just general back pain, general neck pain. We're seeing bulging, herniated, degenerative disc, people that are really staring down the barrel of a surgery. And they're like, there's got to be a better way.
Yep. Your mission is how you can improve, mitigate, or eradicate bulging and herniated discs. When do you say you accomplish your mission after treatment? When can you tell I succeeded on this?
Chad and I were in New York City, maybe 8 weeks ago. And we were there. We had a chance to sit down with the first female U.S. Surgeon General. We had a chance to meet some really great people there. And but not during any of those events. Dr. Chad and I were off to the side at one point, and we really came up with this idea that we want to save 1 million people from spine surgery. So that's our goal, is 1 million people. Right now we have 86 locations in 27 or 28 states. And we're just really getting started. Like, I really feel like it's just dramatically changing. As soon as I leave here, I have a call with a doctor from North Carolina that's interested in Genesis. And so we feel like that's going to be a big deal. And we had a guy say yesterday, 1 million's just going to get you guys started. But that right now, that's our goal, is 1 million people from spine surgery. We've got the back end metrics to be able to track all that.
That's great.
And so, yeah, we're passionate about it, and not just like, we don't want to get lost just on the number, but you need a horizon,
mass.
right? You need to know where you're going.
Yep.
But we're doing it one single individual at a time, and every individual that's sitting in front of us matters. Of like, how do we improve your life? How do we give you, the freedom and the independence to do the things you want to do the things that God created you to do in the first place, and live the life that you were designed to live, without drugs and without surgery and without just trying to struggle through this day to get to the next day.
Is it easy for you to suggest patients to give it a try, to the decompression therapy first before they commit to surgery? Because a lot of times people, they just hear to one doctor, and I feel it's so critical for them to seek medical advice from more than one person. And I've had many cases that I can attest that I told guys, you should hear to other people. Not every opinion is going to be the same. Don't just take surgery as the only option there, or your only option.
Yeah. Yeah. And, I would say, and again, I'm biased, but I would say definitely seek out a Genesis location or somebody that specializes in spinal decompression to see if it's an opportunity that would be able to help. Because worst case scenario, you come to me and we try our hardest and you try your hardest and it doesn't get better, you can always have surgery. But if you go have surgery, then we have to wait at least a year before we can treat you. And depending on the type of surgery and where you had it, we may or may not be able to treat you. So we had a lady probably last week that was 5 weeks out from spine surgery, and she's in worse pain than she's ever been. And she's called the office and she's like, you guys have to get me in. Well, it's 5 weeks out. It's really unsafe for us to treat her at this point. And so it's like, you've got to give it. You've got months to go before you would even be a candidate for us. And so we think everybody deserves a chance to beat it naturally. Try it naturally, try it without surgery. With that being said, there are times that people will come in dire straits, will look at their information, and it's like, as much as I don't want to say it, you're not a candidate for this. Surgery is the option you need to pursue. Then, like you said, even if you're going to have surgery, get the recommendations of people that have been there and done that, and then go see 3 of them and interview them and see what their take is. And I really feel like, you'll feel led to go one direction or another, but just to go see one person and go do that thing without getting any other input it's pretty wild, especially when the stakes are that high.
What condition do you most frequently treat with DRX 9000?
It's only one condition. It's a disc issue.
Okay.
So whether it's a bulging or herniated disc.
In the map of a spine, is it lower back more prevalent than upper back? Or
I would say 60% of the patients we see are lumbar. So that's sciatica.
Jiu-Jitsu guys.
Jiu-Jitsu guys. Yeah, we see lots of lumbar stuff.
Yeah.
And then with cervical, we see numbness and tingling in the arms, that sort of stuff. We probably see that about 40% of the time. Last week, I had a golfer that was a high-level golfer. He had a T9 herniation. So T9, if you were a woman and you had a bra on, it's pretty much where the bra strap would be. Mid-back, we don't have our machine doesn't treat that. The DRX cannot target a thoracic disc. I probably only see it once or twice a year. And so that was a tough one to be like, man, all I help are discs, but I can't help your disc. So it's cervical and lumbar, probably 60% lumbar, 40% cervical.
I've got a question, Doc. I'm hearing the engineer nerd inside of me is hearing decompression, pulling, and I'm thinking of gravity. And with the epidemic of obesity in the U.S., can you kind of speak to how much body weight, or being overweight, excessive body fat can hinder better results for your patients? Or is that even an issue for you? Is that something that you don't deal with? I'm just curious to hear about that.
It is. I mean, I think that you can go to any public venue and look around. My family and I got to travel to Europe this last year. And so we spent several weeks in Italy and France, and it just doesn't look the same as it looks here, right? The people that are there that are really overweight came on that plane from here. And so we see a lot of people dealing with just excess body weight. And while I don't know that I'd necessarily contribute that to be the cause of a lot of what we're seeing, it's a contributing factor. So if we go back to the car that we're talking about earlier with the low tire and the speed bump, if you load the bed of the truck up with rocks, well, then the margin becomes even less. And so it's not necessarily what made the tire go low, but once you load that already stressed situation, it becomes even more problematic. So sometimes people are quick to go, oh, well, if I just lost 10 pounds, my disc problem would go away. No, you'd still have a disc problem, just like you'd still have a low tire. It just may be a little less symptomatic because there's less pressure on it.
Gotcha.
But yeah, everything that we can do to take care of ourselves, to just, when we hear about stewardship in the Bible, we're always thinking about money. But man, stewardship to me is like we were given one vessel. Like this is the only body you have to live in.
It's like your temple. Your
it is.
temple.
And so the better we take care of it, the better we revere it, we honor it, we do the best we can by it. Not that any of us are perfect, me included, chief among them. But it's like, this is the only one you got. You don't get another one. So
in regards to, hold that thought.
Yes, sir.
On the growth of Genesis, guys, every time I talk to your staff, Alicia, I'm not exactly sure what position she occupies, but she goes a lot to Oklahoma and other places to help out, open other locations or train staff for new locations. You're always, every time I reach out to Genesis, the one in McKinney, which is near me, you guys are always going to open somewhere else. What has fueled that growth? How's that?
We've never advertised. So we've never put out a postcard or cold called the doctor or tried to expand. It was a friend told a friend, told a friend, told a friend. And these doctors keep seeing what we're doing and they keep going, I want to be a part of that. How do I be a part of that? How do I learn more?
So you have people reaching out to you?
That's only the way we've ever grown, up to 86 offices so far.
Organically.
Alicia started in our 101 office. So the office that I talked about, Chad and I starting originally, Alicia was first employee there.
Wow.
And so it was a ghost town. We were just getting started. Now she's the COO of a multi-million-dollar company, and she's just been incredible. She's been a huge blessing to us from day one to day now. And so that's been fantastic. But we've only grown by word of mouth. The back of my shirt says Tigers Only, and that's all of our doctors are Tigers. Like, we don't have any doctors that are new to the profession, that are just graduated out of chiropractic school. Not that there's anything wrong with that, and not that are struggling to make ends meet or not sure what they want to do. Most of our doctors are 8, 10, 12 years into practice. They're already wildly successful. They're great communicators. They have great reputation. They're having a great impact. They just want to be able to add something to go, man, I think I can help another demographic of patient that I'm not currently helping. And I can do it with something that's congruent with my mindset of trying to help people avoid drugs and surgery. And that's 88 to 91% effective. I want in. And so it's been an enormous blessing. I think one of our greatest strengths is the team that Chad and I have surrounded us with, our corporate team. All of those people are incredible. And it's the partners that have been brought to us. Not that we've sought out, but the good Lord keeps putting people in our path that are passionate, confident, smart individuals that are having a huge impact.
Tigers Only. That's because you want guys that have quote unquote maybe earned their stripes in the game of chiropractic.
Yeah.
It's a very military term. Tigers Only, or guys that have earned their stripes. I thought it was martial arts, and I was like, no, he said he's not a martial artist, but then he said Tigers Only, and I'm like, why do you want a tiger? What's a tiger's fierce, probably loyal, and knows how to fix knows what it wants when it wants it, but the stripes are earned, right?
That's right.
They're not born with their stripes, if I remember correctly.
Yeah, that's our corporate mantra is Tigers Only. I came up with that a couple of years ago. It's like, whether it's the people that we hire, whether it's the doctors that we're seeing, it's like we're only dealing with tigers. We're not dealing with kittens. We're not dealing with people that are small-minded or are reserved in their ability to think bigger. Like, how do you think beyond yourself, beyond your office, beyond your city? Like, how do we have like the tigers? And I got to say, like, we've been blessed with just a room full of tigers. Last week in Frisco, we had our annual summit. So once a year, we have everybody fly in. And so we had our summit at the Frisco Hall. We had 225 people there. And wow, just what an incredible event with great doctors, great staff, everybody that's really passionate about what they're doing. Nobody's doing this for the money or for the accolades or for, everybody's doing it because it's like, let's have an impact. And so I told a story there that in 1945, there was a fire. It was in a place called Man Gulch, Montana. 15 smoke jumpers deployed to fight this fire. And so they get deployed, they get their gear on, they get their equipment, they march to the fire. When they get to the fire and they start fighting it, the wind changes suddenly and it starts blowing the fire directly at them. So the wind, all of a sudden, these guys are like, we're all going to die. They throw off all their equipment and they take off running as fast as they can. Well, the foreman that day was a guy named Wag Dodge. And so with the fire closing in, pandemonium all around, he did something no one had ever seen. He pulled some matches out of his pocket and he started lighting the ground around him on fire. His crew thought he had lost his mind, but he was like, no, I think if I burn up all these bushes and the grass around me, that whenever the wildfire gets to us, it won't have any fuel left to burn. You see, he understood if he claimed that area first,
Wow.
then the wildfire couldn't claim it. And so his crew said, no, it'll never work. You're insane. And they ran for their lives. The fire he started that day is something now known as an escape fire. And it saved his life. The other 14 guys died. Wag lived. So right now, that's one of the things that we're talking about is we are in the process of setting escape fires all across America, in every city, in every state, pardon me, where people can have this ability to, if we claim that area first, the large pharma, big pharma can't come in there and rape, rob, and pillage the people that they've been doing.
Yeah.
We're going to create escape fires across the country. And so that was really kind of the theme of having everybody in, and everybody with one purpose, one mission, 1 million people we're going to save from spine surgery. And so
I think you're going to beat that mark. You want to go back to the stem cell question?
Just kind of I know that's probably not your main niche. I'm just curious from the professionals that are out there. I know there's some trials and stuff going on in that world. Just what's your take on from your experiences? Is that even a thing that's repairable for spines right now, or where are we at with that from what you know?
So I'll preface this by saying I'm certainly not an expert in stem cells, but I think stem cells will be the wave of the future. I think it will be the future of medicine will be around stem cells. I'm a believer. I'm against abortion. The stem cells that we need are ethically derived stem cells. They're called mesenchymal stem cells. And it's really, I think it's going to be incredible what they can do. From what I understand right now in the United States, we cannot access the stem cells that we really need to. I think to truly get great stem cell therapy, you got to go out of the country right now. That's what I understand. Again, somebody may contest me on that, and I would yield to them. But what it comes down to is, so if we're shoulders, knees, hips, elbows, ankles, feet, I see really good changes with stem cells. I think there have been some stuff with the spine. And if we're talking about a herniated disc, if there's compressive force and it's pushing that disc out, there's no amount of stem cells you're going to put in that disc to fix that flat tire, if you will. Mm-hmm. And so maybe stem cells used in conjunction with true decompression, I think could be something in the future. But right now they're wildly expensive. They're pretty experimental. And then I've not found much success of people using them in the spine. Again, limited understanding of it, so it's not perfect, but I think it's cool. In my office, we use something called a soft wave device. It's an Ortho Gold 100. We were the first chiropractic office in Texas to have one. And what it does is it uses supersonic sound waves to basically mimic microtrauma in the area, and it recruits dormant stem cells, latent stem cells, to come to that part of the body for regenerative change. I know with my mother, we put stem cells in her knee, $5,000, no change. It's like, golly, about a year and a half went by. She never got even a single % of change. Talking to another colleague, and he's like, oh, well, my stem cells are better. You need these guys' stem cells, mine are more potent, all this stuff. So another $5,000 in the knee, no change.
Wow.
And so, and maybe she's the outlier. That's just my experience with my own mom. But this soft wave device for hips, knees, shoulders, particularly with the guys that follow you guys, I would, if anybody's having like soft tissue stuff, any sort of an itis, if you will, that machine is really incredible. And there's a lot of them out now. So you could look up Ortho Gold 100 or a soft wave and find one in your area, a practitioner in your area. But when it comes to a disc, even as much as I love soft wave, as much as I think stem cells are great, chiropractic's great, for a disc, it's a decompression or surgery.
Mechanical.
Yeah, it's mechanical. I tell you this, I've had quite a few people I recommended the decompression, and Genesis is the first option I recommend. And in many instances, they have, if not in the same city they live, in the vicinity, somewhere in another town, not too far. But if for some reason they don't find it, I send the information on the machine, the DRX 9000 machine, because there's still some chiropractic or establishments that carry on. Mm-hmm. So at least they can kind of, and one in particular was the gentleman from South Carolina, Patrick Sweeney.
Yeah.
He has had lower back problems, and he did do the 12-week protocol, and that he had similar results as mine. So this is not so much me giving you a testimonial. I've seen that happening. There's a gentleman here in the Metroplex from Irvin or Las Colinas that went to the other location here from there, and same thing happened. So I've seen that work even while I was being treated. My wife mentioned to one of the dads of my son's teammate in the football team He arrived on a wheelchair there. I saw him on a couple occasions while I was doing my consultation. That he was my visits. I already had been consulting with you. He was there doing the treatment, and then at a later time, it seemed like we always kind of went at the same time, one after the other. He was walking, no wheelchair right there, man. And I remember, for me, a big deal was when I was able to drive without an ice pack or a heat pad on my butt, because that's how bad it was for me, even when I drove. And I said, man, I don't need this anymore. So you have those small, for people who are out there that experience pain, you have no idea how meaningful it is, the small increments of comfort that you feel after you do your decompression session. So with that said, do you have any partnerships that you associate with others other than the group that you have, or research into the decompression, spine decompression science? Is there any research still ongoing? Because I would assume you have a lot of data by being this decade and a half plus years that you've been using it. You probably have a lot of material that you can share, right?
Yes, for sure. And so the machine itself is manufactured by a company called Excite Medical, and it's out of Tampa, Florida. Just like you said earlier, we'd love to take care of anybody that we might be in your area and we could help. But if you look up and you're like, okay, there's no Genesis anywhere near me, you would go to the Excite Medical website, and there's a provider locator that will at least have that machine. And that's the most important part, is that you're working with that DRX 9000 technology. And even if you have another guy that's a great guy, but he doesn't have that machine, you want to go to somebody that has that machine. If it's Genesis, even better, because we use a little different protocol. But if not, that's the next best thing. The cool thing, the guy that owns Excite Medical is a personal friend of Chad and I's. And so the amount of money that they're putting into research right now is really insane. So there is an ongoing study currently, the University of South Florida. The University of South Florida has this in their neurosurgical division. So the neurosurgeons have access to the DRX 9000. And then next door, they're running a study, and it's there's people involved from Stanford University, University of South Florida. And so the amount of science that's continually going into the machine, like I said, that's great for some people. For me, I see these people, like the stories that you're telling me of, like, I remember when I could drive without the ice pack and stuff. That just gets me going. Like, that's what I get to hear those things all day. And so, but there's a lot of people that's like, I want to see how many, how many grams of pressure that is taken off of that intervertebral disc. And I need to know the clinical, studies and all that sort of stuff. It's all there. So there's a ton of studies. If you go to genesisback.com and you click read the research, you'll just drown in research, a ton of research there. Some people really thrive on that. Some people, it just is pretty boring and it's pretty heady science stuff. And those people just read reviews and, hear stories like yours. So
that's great. What's your vision for the company in terms of the mission that you still feel you have ahead, and the national or maybe international presence of Genesis? That's something else I was curious, because, with our organization, we have nationwide and we have across the oceans. And I think doing such a good work as you are doing, I mean, you should be everywhere,
Well, I appreciate that. And the guy that owns Excite Medical, Salim, he has DRX 9000. They're all over the Middle East. He just got sanctioned to bring it into Europe, but you can go to Switzerland, you can go to Dubai, you can go to Israel. Like, this machine is out there. But for us right now, we're only in the United States.
Okay.
And so Chad and I have never really tried to force this is what we have to do to be successful. It's like, how do we just help as many people as possible? And so we don't have a number of clinics. So we have a number of people we want to help, but we would rather than trying to check boxes to say we have this many locations, we only want good locations. Whether there's a ton of them or there's a few of them, we only want the best doctors that have high integrity, that care about their patients, And so we're not forcing ourselves into like, we're trying to get to X number of locations. It's like, how many people are we actually going to help?
I got you.
But we want to be, we'd like to be international. So we'd like to be able to bring this to Europe. We've talked to people in Puerto Rico and Canada right now. And so that will be the next thing on the horizon is like, we don't see a limit. Like, oh yeah, well, we can't go there. We'd never go here. It's like, no, we're going to go where people need help, and everything that we can do in our power to get to those people, we're going to do. So
that's great. Well, we're coming to the conclusion of this amazing conversation. Is there, and we're going to have all the resources listed on the bottom of our social media posts and also included on this podcast. Is there anything you'd like to add besides Genesis, your website, or how to reach you, or just a final statement in itself?
Well, I would just say thanks for having me on.
You're very welcome.
It's super cool. It's super cool to see what you guys do and the people that you're taking care of. I've gotten to take care of so many jiu-jitsu guys now, and they're insane. Like all of them are so passionate about what they do and so disciplined in what they do that they're the most coachable patients that we have. If they're CrossFitters or football players or whatever, man, you can get some, non-compliance, but jiu-jitsu guys are so coachable. And so we love being able to take care and help those people. I think parting words would just be, it's just a true blessing to do what we're doing. I wish we could sit back and say, oh, well, Chad and I have developed this business acumen and this growth strategy, and we're executing all these things that we've created. Mm-hmm. We are just simply the innocent bystanders of an abundant blessing from the Lord. Mm-hmm. And so we feel like God's given us this, and we're trying to be good stewards of it. We're trying to do the best thing by the patients that we serve, number one, by the partners that we have in Genesis, number two, and then by all the families that are being affected by it. And so we're along for the ride. We're trying to do the best thing in the situation that we're in. We keep being very choosy. We're only taking tigers, like we said earlier. So we've turned down more doctors than we brought on, but we really feel like the integrity of the movement matters, not the company. The company is one thing. It's like we're on a movement. Like we're building a national escape fire that will sweep the country.
Wow.
And so we're just loving every step of it. None of it's felt like work. It's not like high stress. It's like every day, it's like we're having an impact. One more person. So
I love it. Anything else you'd like to add, Roger?
Yeah, I'd like just to, for everyone who's watching, where can they find you? Either social media, website, YouTube, anything you have out there so people know how to get a hold of you.
Yeah, so Caleb Braddock, CALEB BRADDOCK. I'm on Instagram. I'm on Facebook. I love connecting with people. So follow me individually. We have Genesis Back is everywhere as well, but I'd love to just connect with people, on a personal level. And then our website is genesisback.com. So you can look us up there. There's a provider locator on there. So if you're like, I wonder if there's a Genesis near me, you'll be able to see all the locations there. We have 23 offices that are currently onboarding. So they're signed on, but they're not opened yet. But those will all be available on there. Emails, the whole 9 yards. But yeah, Facebook, Instagram, we do a little TikTok, but we're just working our way into it. So
very cool.
Right on. Awesome. Thank you, Doctor. It was a pleasure, bud. Thank you so much.
Thank you. Appreciate you.
Thank you.